Episode 10: Emotional Pain and Mental Health Symptoms from Fear of Confronting Parents. When individuals are unable to confront unresolved trauma with their parents, the emotional burden often manifests in profound ways, including fear of the world, a pervasive sense of disconnection, and various mental health symptoms. This suppressed emotional pain can result in feelings of panic, paranoia, depression, and anxiety, leading many to seek relief through medication, addictive substances, or compulsive behaviors. These coping mechanisms often reflect a desperate attempt to fill the void left by the missed connection and attachment in childhood. Impact of unresolved trauma on mental health. Studies consistently show that unresolved emotional trauma, particularly from primary caregivers, is a significant predictor of mental health disorders. A meta-analysis in The Lancet Psychiatry, 2020, found a strong correlation between childhood emotional neglect and increased rates of depression, anxiety disorders, and PTSD in adulthood. The inability to process unresolved feelings of rejection or neglect exacerbates these conditions. Emotional pain as a root of addiction. Addiction is often an unconscious attempt to soothe unhealed emotional wounds. Gabor Mate, a renowned addiction specialist, highlights that substance use frequently arises from a need to escape the pain of disconnection and unfulfilled attachment needs. Example: many individuals who experience childhood abandonment, neglect, or abuse report turning to substances like alcohol or opioids to mimic the feeling of comfort and safety they lacked as children. Panic and paranoia as fear responses. The fear of confronting parents, who represent a source of both safety and pain, can create internal conflict, leading to heightened fear responses. This unresolved fear manifests as paranoia or panic attacks, where individuals feel constantly threatened or unsafe, even in neutral environments. Research in Journal of Anxiety Disorders, 2019, found that childhood emotional neglect increased the likelihood of adult panic disorders and agoraphobia, as individuals struggle to regulate their fear responses. Medicating emotional pain. The rise in prescription medications or other drugs for depression and anxiety reflects a societal trend of treating symptoms without addressing the root causes, such as unresolved maternal trauma. While medications provide temporary relief, they do not heal the emotional wounds at their source. Case study example: a woman with a history of maternal neglect might rely on antidepressants for years without exploring how her childhood experiences shaped her emotional health. Substitutes for attachment. Addictive substances, compulsive behaviors like overeating or gambling, or even excessive reliance on social media can become substitutes for the connection and attachment that were missing in childhood. These behaviors temporarily mimic the comfort of a secure bond, but often lead to further emotional distress. Supportive insight. A 2022 study on addictive behaviors highlighted that individuals with insecure attachment styles were significantly more likely to develop substance use disorders as a coping mechanism. Real-life examples. Addiction as a response to disconnection. Many individuals in addiction recovery programs cite unresolved family trauma, particularly related to their primary caregivers, as a significant factor in their substance use. Example: a man struggling with alcoholism described drinking as the only way to feel warm, echoing the comfort and connection he lacked in his relationship with parents. Paranoia and hypervigilance. People with unresolved childhood trauma often report feeling constantly on edge, mistrustful of others, and overwhelmed by fear. This paranoia stems from their unmet need for safety and reassurance during childhood. Mental health epidemic. The growing prevalence of depression and anxiety worldwide is partially rooted in early attachment injuries, with unresolved parent issues being a key contributor. Consequences of unprocessed childhood trauma. Chronic mental health struggles, anxiety, panic, and depression become recurring issues that dominate an individual's life, impairing their ability to function and maintain relationships. Dependence on external soothing mechanisms. Whether through medications, substances, or compulsive behaviors, individuals seek external means to manage their pain, often exacerbating their sense of disconnection. Cycle of disconnection and isolation. The inability to address the root cause of emotional pain creates a cycle where symptoms persist or worsen, further alienating individuals from themselves and others. Conclusion: releasing the burden. Unresolved trauma with parents can weigh heavily on individuals, leading to mental health struggles and maladaptive coping mechanisms. Confronting these emotions, not out of blame, but as a step toward healing, is essential for breaking the cycle of fear and disconnection. By addressing the root causes, individuals can move beyond the pain of their past, find healthier ways to meet their emotional needs, and create a life of greater balance and fulfillment.